Hey, what's going on? I'm gonna try to see if I could do this. I'm sitting, you know, against the wall right now. I'm trying to change my position. Maybe it'll help me with my consciousness. But my mind it's really messed up. It's definitely a 6.5 to 9 easily. In 10, you're passed out. Like when it comes to my overall thinking, it's bad. But I'll try to say what I need to say. Um, It's about, I don't know what time it is. It's 3:55 p.m. I think it's July the 17th or 18th, 2017, 2018. So I just got off the phone. My mind, I feel it. It's like I feel blank when I'm trying to talk. But I just got off the phone with a my doctor's nurse or PA or I don't know, somebody on the phone, right? And I sent my doctor a couple of portal messages, and one was about my eyes at the time. They were kind of turning yellow. And to that one, it was, talk to your gastroenterologist. And I've told everybody my gastroenterologist doesn't do anything. He doesn't know anything. He'll even tell you that. He doesn't know. Um, I mean, there was even times like I think it was in one of my videos, and it was talking about um, when I was at the hospital last time because I was dehydrated or whatever I was, you know, and I was talking about my gallbladder and whatever, and I was talking about my gastroenterologist and whomever, right? Actually, a few doctors, and the doctor that was working on me, and then the nurse person, um, on in different times, right? It wasn't the same time. They weren't both in the same room, but they both said there was like, oh wow, maybe you should find a new doctor. I'm like, yeah, I mean, I wish I could, but this is Texas. That's how they are. All of them are. But I was telling him like, my mouth is like dry or whatever. I don't know. Foamy, foaming at the mouth, Cujo. But like I've been getting pain on my right upper quadrant for years, and everybody freaking ignores me. They do these ultrasounds and they're like, oh well, we can't find anything, right? Or you'll have these alleged polyps of gallstones or whatever, cholesterol deposits, whatever, and then they'll turn around and say, well, you don't have it. So okay, well, did I have it or did I not have it? Just had one recently, and once again, I don't have it. But you know how doctors are. They'll be like, well, maybe you did, and maybe you did have that sludge, and well, now it's gone. I mean, I don't know, If so, hallelujah, right? What a miracle. But I'm still having these pains, And then the doctor's like, the gastro is like, okay, well, you know, I'm not concerned about it. Well, okay, well, what do I do for the pain? Well, take Tylenol or something, you know, Advil or whatever. I'm like, what? You know? I mean, to me, that saying in general is disrespectful. Um, and I'm like, wow, right? So yeah, he doesn't care, and it's like, okay, how do you heal the gallbladder? There's no way to heal the gallbladder. I remember talking to a PA about that, and he's like, yeah, there's Western medicine has no therapies or whatever to heal the gallbladder. It's basically just surgery. I'm like, what the hell, dude? Are you serious? Yeah. I'm like, whoa. My ejection fraction is allegedly 30%. Well, that's still low. 35 and below is like not good. Years ago in 2014, I had a HIDA scan. Ejection fraction was 12.8 or something, which is like freaking low. But they were saying that the person probably did not do what they were supposed to do the right way, and that's why it was so low. But either way, I have a poor functioning gallbladder in general. I have a family history of this. Nobody cares. The Gilbert syndrome, Gilbert, that's how you spell it, Gilbert syndrome. Because I've been having elevated levels of high bilirubin in my blood. So they automatically, without doing any test, they automatically assume that's what one has when they see elevated levels of that. Automatically. Right? Well, I was like, you know what? Let's do a damn genetic test. Somehow I actually got it. So apparently, well, and even that wasn't very helpful, but apparently it takes two genes to tangle. It takes two genes to make that diagnosis, right? Well, I only have one gene. I have one gene. I don't have two genes. So it could be it could be Gilbert syndrome, Gilbert syndrome. It could be. But it might not be. I mean, if you even look at my blood at times, people wonder, could that be related to the bile? What is God, I haven't said it in so long. I think it's like hemoglobin is the breakdown of red blood cells or something, or maybe bile is a breakdown of red blood cells or something. I don't know. But I know that, it can create a lot of bile, right? So I don't know, just like the bile reflux. I'm like, is there a treatment for this bile reflux that I'm having? No. I'm like, okay, so what about like, these pump inhibitors, these antacids? No. Because bile reflux is not the same as acid reflux. Bile reflux is more of an issue where the bile is actually backing up and you're puking it. Oh wow. So yeah, cray, right? So I'm like, I need a gastroenterologist, but everybody I've seen basically just says I'm fucking nuts, that there's nothing wrong with me. And the shit shows, man. Just like when I was in Austin and I would go to these gastroenterologists and they're like, oh well, all this workup was done and blah 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 and woof woof woof, and I had to come down to San Antonio and finally see a gastroenterologist, and they finally scoped me, and oh shit, what did they just find? A tubular adenoma. If you don't know what that is, maybe I should look it up. It is particularly it can be cancer. It's so I think it's a tumor, I think, or something, but it was benign. They allegedly they did a biopsy and said it was benign, so no cancer. That's good. So no colon cancer, which by the way is very very bad. If you get colon cancer, your chances of survival is, let's just say, yeah, it's bad. Like what I got right now is bad. A lot of things I got is bad. I'm trying to do this. So like the cardiologist, people, it's like, oh well, you got anxiety and you have mental issues and there's nothing wrong with you and blah blah blah. And I'm gonna make sure there's, I'm gonna prove to you you're not having palpitations and all this bullshit. You have mental issues. One of them I saw in Austin, I was looking at the reports and he was saying that I had anxiety or whatever, psychiatric issues, right? And then another one I saw here in San Antonio was saying that I had literally mental issues, that it was in my head. And he was going to prove to me that I didn't have palpitations or issues or whatever. and to stop taking my blood pressure and to ignore all signs that's posted. If you have these symptoms, call 911. He's like, oh, well, it's the law. You know, it's the law. Huh. But I think he did do some test and it came back abnormal. I think so. Um, but I just kind of, I said, fuck it. I didn't really want to see him anymore. And then I saw his predecessor, I guess, the person that took off. And, I got a new one there. And that guy basically just said the same thing, that I was nuts. And there was nothing wrong with me. And I was telling him, the palpitations and the heart issues and whatever, bradycardia or whatever the case is. And they did different tests. They did a stress. See, I've actually had a stress test in the past, and oh my god, dude, like the treadmill. Years ago, I think I got up to like 192 beats a minute or something. Like I think I was supposed to go like 200 or whatever it was. I don't know. It was fucking high, dude. I thought I was gonna die. Like when I stopped and they did that echocardiogram, I was huffing and puffing out. I was literally exhausted for over a day. I remember that. But down here, they I think I first had an echocardiogram. It was actually abnormal, and then they wanted to do a stress test with some other stuff. So they put a radioactive material in my body, a radioisotope, and then they put me on this. It's kind of like box cameras or something. It's like one and one here, and it's just you sit in a chair and it just it does whatever, and I guess whatever. I guess it tries to get the tracer, tries to capture that, and that was abnormal, right? So one test abnormal, two tests abnormal, and then they did a stress test, in IV medication. I thought I was gonna fucking die. Like I was freaking out for a second, but I took it, and I was all good. And then all of a sudden, I started to feel. I was just laying there, people were like, "Calm down." I was like, "You know what? Okay, I'm gonna calm down." And then all of a sudden, because I've never had this before, all of a sudden I felt this weird pain sensation in my chest. I'm like, "Oh whoa, what the fuck?" And then all of a sudden, I just. Oh my god, oh my god, oh my god, oh my god, I'm gonna die. Oh, shit. Calm down, sir, calm down, sir. It's not in your system anymore. Fuck you, it's not in my system, bitch. Fuck you. But they put it in, and I guess it only lasts like so long or whatever. You know? But they don't think it's in the. But what it does is it essentially causes heart block. Essentially, temporarily. I guess they move the blood, or I guess the heart or something moves the blood to another section. But yeah, I mean, I don't know what my vitals were, but it was abnormal. But at the same time, I don't think it was completed. And instead of, them saying, okay, well, he had a reaction to this drug, they basically just said I had anxiety. And then they wanted to do a angiogram. I was like, screw that. I'd have a heart attack just from the pure anxiety of getting that. Like unless I'm having a heart attack, bro. Like, come on, bro. And then they were suggesting doing a CT angiogram, and I'm like, maybe a decade ago if we did that, maybe I'd be willing to do it. But I've had hundreds of x-rays. Hundreds of x-rays. Over 100 regular x-rays. And then I've had multiple CT scans when I was dumb and I didn't know anything. I actually remember when they were doing chest x-rays on the regular, like it was no big deal at the hospitals. And they wouldn't even cover your reproductive parts up. Which they're supposed to, and they never did. So who knows? I don't know about my reproductive. I mean, I just know the last time I got my stuff tested, it wasn't I mean, I had enough to do the job, but it was low. It was normal, but it was low. I think it was like 50 million or something when it should be like 250 million or something like that. So apparently, I had 6 times the amount to get the job done, but it was still low, and that was after 7 days. Um, so who knows? I mean, that could be many reasons. Um, yeah, it could be many reasons. It could be my nutrition. It could be health. It could be, I don't know. And then just most people in the world, they have a low count these days anyway. Um, all that beta food. But yeah, so the cardiologist, like I told my doc, I was like, hey, look, I want a referral to UHS for cardiology. That's what I said. Um, and she didn't. Let me go back for a second. So I was like, you know what? I don't want to. I don't want to do that. Fuck that. Because you actually have a high chance of getting at least a 5% chance right off the bat for getting cancer. 1 2 people men get cancer in general. My mind is fucking fried. So I was like, okay, let's try to figure a different way out. And I was thinking, okay, well, MRI work? No, not really. I was like, okay, well, what about an MRA? And like I've tried to get info to this doc, and the doc doesn't really seem to want to reply. I'm like, well, what the hell, man? Like, yeah, but yeah. So on the X-rays and stuff and the angiogram, not angiogram, but I've also had a couple echocardiograms or whatever, and it does, and it has, in a couple areas show that I had mild enlargement of my heart. I think particularly the right valve or whatever. But at the end of the day, you go and you see certain people or whatever, even my regular doctor, and they're just like, oh yeah, it's just mild. Like, it's fucking nothing, dude. And I'm like, are you fucking serious? Like, I got Hashimoto's, and they're like, oh, well, they don't think you have Hashimoto's. I'll get to that. So, to the cardiologist thing, this, I guess, is kind of going to be a long video, but I'm talking, right? So, to the cardiologist thing, is the referral is I was talking to my doc, and I was telling her, I was like, I don't want to go over there. I just haven't really had the best treatment. Like, I need to get shit done in general. Like, I even asked her for an MRA, and she's like, oh yeah, you got to go see the cardiologist, yada yada yada. I'm like, you know, and then it just yeah, I was like, oh, okay, cool. I thought that was gonna happen. Then I get a phone call or whatever, or I call to set this up for a UHS, and then I find out, well, it was referred to the place that I told them that I didn't want to go. But the bitch didn't listen. I'm just like, are you serious, dude? Just like the PA that I saw one time. I don't know how the hell I saw her. I was supposed to see the other person, the other PA. But I saw this person, and I told her because of the eye vision issues, that I need to see a, neuro-ophthalmologist, or whatever. And I told her that I can't go to UT. Fuck you. I can't go there because I got fired. By the way, there's a lot of different one of those, by the way. I've been to a couple of them, so you never know. Um, but yeah, so, oh, Lordy. So I went over there, or so I can't go there. And she's like, well, I don't know what to tell you. That's exactly what she said. She was like, I don't know what to tell you. I'm like, wow, right? And then I get a call from them saying, they wanted to schedule an appointment. It was voicemail, but like I got fired. So as soon as they find out who I am, they're gonna know that I'm on a block list. And I feel like even if I went over there, like any of these damn people, nobody does anything. But yeah, so like I said, the doc called, the nurse called earlier, and they were talking about um, the bio the jaundice, the mild jaundice that I was having, and that was go see a gastroenterologist, and then I think they brought up cardio, and then they brought up and then I brought up uh, the referral issue. Um, I also brought up the thyroid issue, the autoimmune Hashimoto's encephalopathy, and apparently the endocrinologist believes that I don't have this. You don't believe? Wow, there was like a hole in this thing, dude. Like, look at that. I didn't realize that. Guess somebody they patched it up. You see? I didn't even know that. Apartments, man. But yeah. So I was like, wow. And then like the cardiologist that uh, I saw the I don't know what they're called. I just call them the heart electrician doctors, um, electrophysiologists or whatever over there, and because I was referred by one of the cardiologists there to see her, um, and she said that the because I was referred over there because of uh, anomic damn it, I forgot what you call that, autonomic autonomic dysfunction. And when I went and I tried to talk to her about this, she didn't really seem much. She didn't really seem to know much. She was like, it's, that's pretty hard to, diagnose or figure out or whatever. And she was just recommending. I think she recommended like stress reduction, like meditation and yoga and whatever. I don't know if she said diet or anything. The endocrinologist stated diet and taking supplements and shit and whatever. Um, I think she said exercise. I mean, I don't know. Maybe the endocrinologist, the cardiologist, or electrophysiologist said that. But yeah, but apparently, according to my doctor, she said I had anxiety. So she said that I had anxiety, and then the endocrinologist said that they didn't think I had Hashimoto's. Yet I'm seeing the only neurologist in town that specializes in dementia and really bad degenerative diseases because no other neurologist knows how to do anything, allegedly. And I personally think it's not that simple, but she's basing the fact that my antibodies, how the fuck do you think I don't have, like, okay, first of all, I'm sorry for cussing, but how the hell do you not think that I don't have Hashimoto's, even though I've had multiple tests for my TPO-AB antibodies, which are high. They're not crazy high, but they're high enough, right? So, and then you got another antibody that pops up, thiglobulin antibody, which is even higher than the other one, which can really cause issues. I mean, hell, when I was at the hospital that day and we were talking about my Hashimoto's. They're like, oh yeah, that can definitely cause. I guess they were talking to other colleagues or whatever. They're like, oh yeah, that could definitely cause heart issues and whatever, right? So they just they ignore me. One says that I have anxiety, and another one says I don't have that, even though I believe she may have actually. I think she's the one that actually tested for the thiglobulin. I'm just like, are you freaking serious? Are you serious, man? So, I mean, I'm thinking about, I'm kind of lost right now. I'm kind of trying to come back from this, wherever I'm at right now. But I'm thinking about, I feel like I need to shave a lot more. I feel younger when I shave. I look a lot younger. But, I feel, and then it's like, and even when I went to, and I saw my PCP last time, and I wanted to talk to her about whatever, but I was also having um, heart issues. Like my shit was kind of crazy, dude. They're like you have anxiety, you have anxiety. You need to go see a shrink. Blah 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 blah. You need to go see that kind of shrink. You know, the one that gives you pills and shit, right? And they're like, well, we're gonna do this EKG, and if it comes back, normal, you have anxiety. It wasn't normal, by the way, but it was within rhythm. So they try to act like, okay, well, it could be fast, but within rhythm. So that would be called sinus tachycardia, right? Yeah, or tachycardia sinus rhythm. So it's within rhythm, but it's quick. I remember when I was at the hospital and my pulse was like 114, I would say was averaging. And then it would drop down to 100, and then it would go back up to 114 or 120 or whatever. But I noticed a lot of times when I was there, it would drop down to like 92 or whatever. And then I would start having the sensation like my heart's racing, right? And I look at the monitor and it's like boop, 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 boop. I'm like, whoa, 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 what the fuck? Whoa, whoa, bing! 140, 141, 141. Holy crap. And it stays up there and then it goes back down. It stays in the 114 range, 116, whatever. Sometimes it might be 100. But when I noticed it started to go back down to like the 90s, it started to do that again. It shot up. And I told the doctors about this, the staff over there. They didn't really seem to care. They're like, oh, well, all that's charted in your charts, essentially. But because it's within rhythm, it's no concern. But they did tell me, hey, you need to follow up with the cardiologist. Hence, that's why I was trying to get a cardiologist from my doc. So yeah, I don't really know what I'm talking about anymore, especially at 28 minutes, 29 minutes. But I'm seeing these doctors and they're half-assing shit. Just like she also the nurse person, the caller person, she said that my thyroid function was unremarkable, which fucking pisses me off about the UHS for real. Is they always say that kind of crap. Like it's almost like they're all trained to be ignorant. Well, because it's not severe, because you're not having a heart attack, you're fine. Even though you could be having symptoms of, you could have a heart attack very soon. They don't care about that. They want your ass to have a heart attack. They want your heart to, They want the tombstone line, essentially, before they will even help you. This is just 14 years of what I've been through. Almost 14 years. I mean, I guess you could say 14 years, but almost. I started to really get health issues in October of 2004. So, they said it was unremarkable. It's unremarkable. I just did a video not too long ago about this. And I think I don't know if I titled that as that, but I showed the variations, right? I showed whatever, and they said it was unremarkable. It's unremarkable, but the left side of my fucking neck, all right here, especially right here, I can feel it. It's large. Right here, it's large. Right here, it's large. You see? Right here, that red spot, that's large. Right? It's large. But because I don't have a fucking goiter, or whatever you call it, it's unremarkable. So I have Hashimoto's. Apparently, oh no, you don't. Even though I have tests that proves. I have severe catastrophic brain disease. I'm still functioning for the most part, but I have really bad brain disease. No, you don't. You have psychiatric issues. Even though I have the test to show. It's not just one test. It's not two tests. It's multiple tests that I've actually had. Right? I've had multiple tests that shows the same thing. But doctors will turn around and will continue to be negligent. No accountability because of tort laws. And say, there's nothing wrong with you. You're fine. Or they say, I don't know what's wrong with you. Or you're too young, or you have mental issues, or whatever. That's what they say. You know, it's not specific, unremarkable. You have mental issues, anxiety. You're too young. It's all in your head. You know, whatever. And the list just keeps going and going. And they don't even try to figure out, okay, well, what's going on, you know? Why is this person having... And, you know, and that's the thing. It's like, I've asked people, I was like, you know, how does Hashimoto's happen? We don't know. You know, how does most of these autoimmune disorders happen? We don't know. I wonder how many people have been misdiagnosed or not even diagnosed at all and told that they had mental issues, even though they had really bad issues, and those issues were never addressed and they were never treated. You think about strokes. 700,000 people a year have strokes, right? 700,000. But in this medical system, or what we've been conditioned to believe is, oh, well, you have to have fast face, so your face has to droop, has to be like that, right? That's stuck, right? Oh, that's creepy, dude. You know, face. So I think act right. I think it's act or whatever. I don't know. And then it's like speech, like is a person, you know, talking or you know, or and then time, right, or whatever. But like the thing is even if your face feels numb or whatever, you're having these different symptoms. If you have one symptom, and you don't have to have all of them, if you have one symptom, that could be a stroke, right? It could be a stroke. But the majority of these people will say, oh, there's nothing wrong with you. You just have anxiety. You know what I really love is when you have these kind of symptoms and you go just to make sure that there's nothing wrong with you, and they fucking ignore you. They make you feel like you're just wasting their time. And the thing is they, at the end of the day, they don't even try to see if you even have a stroke. Maybe I've had strokes. I don't know. Maybe I'm having mini strokes. But I guarantee you a TIA is different than a full-blown stroke. Full-blown strokes are more like that. You know? But they don't care. So, I mean, I could think about my other physicians, doctors that I've seen. Particularly one of them, I mean, I could think of a few good ones. But one of them, she didn't do crap. I gained 74 pounds and the bitch said I was gaining muscle. No, I wasn't. I was losing muscle and I was getting fat. To the point I got so fat, I got stretch marks for the rest of my life now on my stomach. On the front part. You know, with all the cognitive issues and whatever. Telling her I couldn't remember my days, whatever, and she's like, oh, you're just depressed. You know, telling her I need to see an endocrinologist or, you know, somebody for something, and she just never seemed to want to do anything. You know, I told her that I had Hashimoto's, and she just ignored me. Just on everything, every freaking level. You know, every level. Which found out I actually did have that, among 1,000 other things that she failed to do anything about, right? And then when I went, I told that office, that group, you know what they did? They sided with her and they fired me, and they said that I was being, I don't know about combative or whatever, but it was like that or something. I went to the office and I said I didn't want to see her because I didn't trust her. I felt like my life was being put at risk. And by the way, it was, because autoimmune Hashimoto's encephalopathy will fucking kill you without treatment. And even then, there's still that chance. So, when I talk about when I talk about doctors, you know, when I talk about doctors, it's not, like I said, I have very high respect for doctors. I love doctors. I mean, dude, that would be awesome. Like, I would love to get better and actually really help patients, right? Help them get better. You know, I'm not about that fucking disease management bullshit. Like, you know, my joy, as long as I'm making money as well, because I gotta feed myself and whatever. But I love these freaking cars that just sit out there for fucking hours. You know, just you know. But yeah, I couldn't just do disease management. Let's get to the root of the cause. Let's get you the hell out of here. You know, and then, you know, word travels, you know. Oh, yeah, he got me better. Oh, wow, really? You know, kind of like a Jesus. Not saying that I'm trying to, you know, Jesus or whatever, but, you know, it's like everybody in the land starts hearing about this person, right? And say, oh, I got to go see this person. You know, and before you know it, it's like, bam, dude, you could really charge some money. You know, especially if you're getting people healthy. I mean, geez. The amount of money I would pay if I could get healthy right now would be, if I had the money, I'd literally, if I won the lottery, I'd give my entire freaking lottery winnings to somebody that could actually get me better. I'd rather be broke and healthy than to be rich and sick. I'd rather be rich. Wait. I'd rather be broke and healthy than rich and sick. I'd rather be broke. How did I say that? Damn it. I was trying to put it in people's noggins. I'd rather be broke and healthy than rich and sick. I'd rather be broke and healthy than rich and sick. I'd rather be broke and healthy than rich and sick. Yeah. So that's a good quote. I actually, yeah. I mean, I don't. Well, because the thing is if you're healthy, that broke can be temporary, right? I think it could be a lot temporary than being sick and rich, because you could have all the money in the world and still have your issues. Oh shit! Right? I'm trying to do something here, but yeah, you could it can take some money. It could take a lot of things. Sometimes, I mean, you got celebrities with tons of money and they're still sick. They're dealing with shit for the rest of their lives, you know? And they even advocate. Like, there's this one, I mean, there's tons of them, but there's this one actress. I've kind of lost a lot of respect for her, because she's part of the political liberal agenda. Let's bash Trump for every freaking thing. It's almost like it's childish. I don't know. It's that in itself is just, I don't know, man. It's like, if you ain't bashing, you're not cool. And if you're not, yeah, basically, if you're not bashing, you're not cool. You're not gonna get into our club, and you're not gonna have a job in Hollywood. And I think for them to be bashing anybody like that, it's crazy. It's like, what has this world turned into? It's like you're bashing someone because everybody else is bashing them, and you think that if you support Trump, everybody's gonna bash you, which could be true. But I don't know. Maybe that somehow ties into my situation in a sense. Kind of like, I don't know, like in a weird way. But I mean, she has celiac disease, um, which is crazy. It's weird because she's like, oh, I'm not talking about nutrition or health or whatever. I'm talking about this guy. He just committed treason. I'm like, are you serious? Like, do you even know what the hell you're talking about, lady? Like, are you serious? I can't believe you just said that. And then what I love, the hypocritical response is, she's sick. She's saying that misogyny, this and that, and blah 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 causes sickness. Well, no, dude. Like, you are the master of your own mind for the most part, right? You're like, you spreading this gossip, which says in the Bible, don't spread gossip, right? You spreading gossip is really gonna start making you sick. Don't worry about what the fuck Trump is doing. If you don't like him, you motherfuckers you motherfuckers always talk about, not my president, right? Not my president. Back the fuck off, wait 4 more years. If you don't like it, fucking riot. Let's see how far you get with that. But I don't know. I don't know what I was saying about that. But she had celiac disease, and she's been sick for a long time. I mean, she still does her stuff, and she has like a bakery, all that, and that's cool. But what I'm trying to say, I'm not really trying to get the political thing going on, but what I'm trying to say is, there's celebrities with health issues, right? And then there's really rich people with health issues. And then there's broke people that are completely healthy. And then there's broke people with severe health issues like myself. Um, and that's the issue. Um, and I don't know if all doctors are like this in the country or the world, but I've talked to a lot of different people that think what these doctors are doing to me is severely messed up. Like, for real, messed up. Like, wow. Like, that is not professional one bit, right? Um, no, it's not. And then I've talked to like natural medicine type people, and they're like, it's weird because regular doctors, it's you're crazy, there's nothing wrong with you, and even when there is something wrong with you, there's nothing wrong with you. Here, just take a pill and shut up, or let's cut it out, and that's a story. Um, that's how they are. But natural medicine is like, they're looking, and the thing is they're probably getting, I wouldn't say that, but they're kind of getting the same education to a point. They still have to learn anatomy and pathophysiology, and you know chemistry, and maybe microbiology. I don't know. All these different things. So they have to. They they know this more, and they try to put it on. They try to approach it from a natural whole body, while doctors, it's like, well, we don't need this fucking shit, dude. We're just gonna, here, take a pill for your symptoms. I'm sure they learned it as well, but they don't use it. And I'm not the only one that would make a statement like that. I mean, there's tons of people, even on YouTube, really like recognizable authorities um, that will mention this, right? But I don't know, man. I just know that I haven't really had the best luck. I don't know how long I'm going to live for. This guy on Periscope named Mitch, he was like, how much longer you got to go, bro? And I was like, I don't know. But he looked like in one of his medical books or whatever. He was like a body trainer or whatever, right? Get a person healthy. And I was like, I don't know. But he was talking about like the chances of death is 10-20% of what I got right off the bat. So I have a 20% chance of death. I don't know what 20% chance of death would be like. I don't know if that's like being in the fucking hood and being white and everybody fucking hates you. I mean, that's probably at least 90+%. But I'm trying to like get a comparison. Um, but yeah, like when I was talking to that lady on the phone, I just, and like everything that I just heard, I was like, and even my doc was like, well, yeah, and even she said, she was like, the endocrinologist doesn't think I have thyroid issues. And I guess the response for that essentially is, with that, my PCP doesn't think I have Hashimoto's. That's killing me. She doesn't think, so she's not going to do anything. You see the picture now? Everything is saying that I'm having this, but nobody seems to care. So I think that I was talking about something and I kind of spaced out there for a second, but so when you see when I talk about doctors in my videos and how most of them are lackadaisical and they don't know what the hell they're talking about, or they don't do anything, this is exactly what's going on. This is what I'm talking about. Like I said, I have the highest praises to physicians, the medical staff in general, that actually care about their patients, that actually want to help their patients. You know, let's find what's wrong with you. Let's not just say you have mental issues and tell you to go to a shrink so they give you pills. Let's actually let me use my mind and try to figure out, okay, what's your symptoms? You know, and think outside of your narrow-minded box. Well, at least most doctors think beyond that. But most they don't know how because they weren't trained, and if it's they weren't trained in that field, they're not going to worry about it. You know, you could literally tell a doctor, okay, well, this stuff has been outdated for so long, and they don't care; they'll still use it. Or, you know, you mentioned nutrition, like, yeah, whatever. You know, like, only thing I've ever really heard about nutrition from them is eat a healthy diet. Pretty much, that's it. My vision is like, whoa, right now. So yeah, and because of the tort law, you can't do nothing. So I think that in general, um, yeah, for my doc, you know, she's not gonna do nothing. Once again, fucking UHS doctors, dude. They don't do anything at all. Or maybe just doctors in general, because every time I see them, they just always seem to have, you know, they don't do nothing. You know, they'll charge the hell out of you when it comes to prices, when it comes to services and stuff. But even when that stuff comes up back abnormal, they don't care. You know, and I've always had this philosophy thought is if physicians were mechanics, if physicians were trained just like mechanics was, you know, in that specialty to fix cars and shit, cars, trucks, bikes, whatever, right? And if they did exactly that, they what they're doing now, they would have no job. There would be probably a shitload of litigation. They probably wouldn't even have a business. They would be ran off like the crooks and cons and the uh, snake potion. I forgot what, you know, those people that used to sell these little potions and stuff or to cure everything. You know, essentially that they'd be run off. You know, what I find interesting is how they say that um, they say that and I love this is Western medicine is apparently the authority, right? It's the authority. It's the superior way of treating health. Well, we know that shit, right? We know. I mean, yeah, doctors at times can help you, you know? That's why I still have hope for doctors. The majority of the ones that I've seen, no, not really. But I do have the highest regards for doctors. You know, even the assholes at times, you know, the ones that I've dealt with. You know, but, you know, it's not good enough. There needs to be accountability. But they're the authority, right? They're the way for health, but it's not health, it's disease management. They're not going to get you better. They're going to drug you up, cut you up, whatever, you know, until you die. You're going to be diseased. You're going to be 60, 70, 80, whatever, taking dozens of pills, being in a nursing home. In fact, they even said the statistics now, kids, parents will be burying their kids today. Is they look at Ayurvedic medicine or naturopathic or naturopathic or holistic whatever types of medicine. They look at that as pseudoscience. Okay, so pseudo means fake. It means fake. You know, it's not real. It's pseudo. You know, like how they say Some people are having pseudo whatever, like pseudo pains or whatever. I forgot what it's called, but it's fake. It's not real. That somehow that there's no medical backing on this type of stuff. So obviously it's not going to help. Well, I don't know, but I think that a lot of these people, I think they get a bad name. But I feel like they actually try to help their patients more than doctors do. I mean, what was it? A while back, they were talking about 50% of Americans are trying to, you know, deal with natural doctors, acupuncture, whatever, right? Herbs, etc. But the thing is insurance doesn't pay for it either. So, pseudoscience, right? But you go to the doctor and they'll just be like, oh, it's not specific. You go to a naturopathic medicine person and it's like, oh shit, like you got all this stuff going on with you, right? I mean, I remember years ago, at least 7 years ago, when I talked to somebody at the well, they weren't at the AMOMA, but they graduated from that place. They were working at some pharmacy or whatever, as like a consultant or whatever. And I talked to her for a little bit, and she was like, "Oh yeah, you have sugar dysregulation issues, and you have deficiency. You have adrenal deficiency." And I ran with that for a long time. I'm like, hey, this is what's going on, right? Doctors would ignore me. Oh wait, now I got fucking blood tests that actually say that I'm having adrenal deficiency issues. Just like my DHEA is low. Which, by the way, if your DHEA, well, it changes, it drops as people age. But when that's low, it is assumed that one has stress. They're deficient, right? Adrenal deficient. The adrenal glands are burnt out. And if it's high, it's assumed that they have tumors and crazy crap and all kinds of issues, right? So, yeah, it is what it is. But I'm going to get off of this thing. If anybody listened to my story, I applaud you. I am catastrophically surprised I was able to even make this video. Like I don't even know how I even made this video. To be honest, I don't know. But I did, so I'm gonna get off and put this in. I really want to work on the keywords though, because I've talked about a lot of different things. Some things maybe I should have not talked about, but maybe some of the words I should have not used. I wasn't really trying to make a profanity. Not that it was too bad. But yeah, this is the way that I feel. This is, these are the things that's happening, and I have tons of different experiences, these kind of experiences. I'm not getting anywhere. But anyways, to wrap it up, I would say that, yeah, I mean, if you're watching and if you like what I see, subscribe. If you want to, comment, I would actually appreciate comments. Just state your, what your thoughts are. Like, I could always use thoughts. If you could think of anybody that might be able to help me out, I would definitely appreciate that too. For real. It's like I need something, man. Like, I don't know. Like, between my insurance and with what I get financially and doctors and everything, I get nothing, dude. I'm getting no help whatsoever, and it's like, what's the point of even going to a doctor at all? I mean, I don't know. But yeah, I don't know how hot it is out here. I think it's like 100 degrees out there, but I'm gonna try to go out there and I'm gonna go to the store and try to get some real quick. But anyways, I hope everybody's having a great day, and if you're sick, I hope you're feeling good. But all right, talk to you later.